Stop. Before you take your next pill tonight, watch this video. Because right now, there's a good chance that one of the medications sitting in your cabinet, a medication your doctor prescribed, is quietly shrinking your memory. Not someday. Not if you're unlucky. Right now. A study of over 58,000 older adults found that common medications millions of people take every single day increase the risk of dementia by 54%. 54%. And the worst part? Most doctors never tell you, not because they don't care, because they don't have time. So, I'm going to tell you, 9 medications, some of them you've been taking for years. And number 1 on this list, I promise you, is going to shock you. It shocked me, and I've been a physician for over 20 years. Don't look away. My name is Dr. Adrian Solberg. I'm a urologist and neurological health specialist. Over 20 years in clinical practice. Thousands of patients, most of them between 55 and 80 years old. And I'll tell you what I keep seeing, over and over and over again. Patients who come to me confused, slower than they used to be, forgetting words, forgetting names, thinking it's just aging. And when I look at their medication list, there it is. The answer they never got. I made this video because you deserve to know what's inside those pills before your memory pays the price. One question before we start. Have you noticed your thinking getting foggier in the last year or two? Drop a yes in the comments. You are not alone, and this video is for you. Here's what they didn't teach you about your medication. Your brain runs on a chemical called acetylcholine. It controls your memory, your focus, your ability to recall a name, follow a conversation, remember where you put your keys. Now, a huge category of common medications blocks acetylcholine. It's called anticholinergic activity. Big word. Simple meaning, these drugs quiet down the exact system your brain needs to think clearly. And here's the part that should concern you. That word, anticholinergic bestials, is not on your prescription label. Your pharmacist probably didn't mention it. Your doctor may not have connected it to your memory problems. And yet, researchers at Harvard, the Mayo Clinic, Johns Hopkins, and the NIH have been sounding the alarm for years. The British Medical Journal published a study, 284,000 patients, and found that long-term use of these drugs increased dementia risk by 49%. That's nearly 1 in 2, and these aren't rare medications. These are pills you've been told are safe. Let me show you exactly which ones, 9 of them, starting with the least serious and building to the one that is silently devastating memory in adults over 60 right now. You reach for these when your chest burns after dinner. Seems harmless, right? Here's what's actually happening. These drugs, especially cimetidine, cross into your brain, and inside your brain, they block histamine receptors that your brain depends on for alertness, memory, and clear thinking. Research published in the Journal of the American Geriatric Society found that older adults taking these drugs daily showed measurable drops in verbal memory and processing speed. You think the heartburn is the problem, but the pill treating it may be fogging your mind. What to do? Talk to your doctor about whether a proton pump inhibitor or simple dietary changes could replace this. And if you're taking cimetidine specifically, bring it up immediately. This one is critical, and I need you to really hear this. Millions of older adults reach for these every night. They work, right? You fall asleep faster. Here's the truth. Diphenhydramine, the active ingredient, is one of the most brain-damaging over-the-counter compounds available to you right now. The American Geriatric Society lists it on the Beers criteria, a list of medications that are dangerous for adults over 65, and a study from the University of Washington, published in JAMA Internal Medicine, found that people who used these drugs for a total of more than 3 years had a 54% higher risk of developing Alzheimer's. 54%. For a pill you can buy at any gas station. And here's the double punch. These drugs don't just attack your memory directly. They destroy your deep sleep, the sleep your brain needs to flush out toxic waste, including the very protein linked to Alzheimer's. So, you fall asleep, but your brain never actually rests. You are sleeping, and still getting damaged. What to do? Stop these tonight if you can. Talk to your doctor about low-dose melatonin, sleep hygiene, or prescription alternatives that don't carry this risk. Cold medicines, allergy pills, sometimes prescribed for anxiety. Same problem, same mechanism, different label. These drugs hit your hippocampus, the part of your brain that forms new memories. Blocking acetylcholine, there is the exact same thing that happens in the early stages of Alzheimer's disease. Not similar, not comparable. The same biochemical process. The good news? There are modern antihistamines like cetirizine and loratadine that don't cross into your brain. They work for allergies. They don't steal your memory. Make the switch. It's a simple conversation. Pay attention to this next part. This is where I see the most damage in my own patients. 33 million Americans have overactive bladder, and the most prescribed solution, oxybutynin, is one of the most brain-toxic drugs available by prescription. It works by blocking the receptors that make your bladder contract, but those same receptors are all over your brain. A study in the Journal of Urology found measurable cognitive decline in patients on oxybutynin after just 6 weeks. 6 weeks. And I see patients who've been on it for 6 years. Here's what breaks my heart about this one. The patient thinks they're protecting their independence, staying dry, staying active, but the medication protecting their bladder may be the very thing dismantling their mind. There is a newer class of bladder drug, mirabegron, that works completely differently. No anticholinergic activity, same result. Ask for it by name. These aren't usually prescribed for depression anymore. Now they're used for nerve pain, migraines, sleep, and they carry the highest anticholinergic burden score of nearly any drug on this list. The Anticholinergic Cognitive Burden Scale, a validated clinical tool, gives amitriptyline the maximum danger rating. Maximum. Patients on this medication describe brain fog, word-finding problems, memory slips, and they're told it's aging. It is not just aging. Alternatives exist. Duloxetine for nerve pain, beta blockers for migraine prevention, safer options that don't systematically suppress the neurotransmitter your memory depends on. Ask. Push for a review, back pain, muscle spasm. These medications are everywhere. And here is what most patients don't know. Muscle relaxants don't actually relax your muscle. They act on your brain. Cyclobenzaprine works centrally, suppressing your nervous system to reduce the sensation of spasm. But in doing so, it also impairs your cerebellum, the brain structure responsible for balance and coordination. So, now you're dealing with memory suppression and balance impairment simultaneously. A study in the Journal of the American Geriatric Society found that muscle relaxant use in older adults was linked to a 40% increased risk of hip fracture, almost entirely through falls. You took a pill for your back, and it put you on the ground. What to do? Physical therapy, magnesium supplementation, and topical anti-inflammatories are all legitimate alternatives worth exploring with your doctor. We are now in the danger zone. These are among the most prescribed drugs in adults over 65, and the research on them and dementia is devastating. A study published in the BMJ, nearly 9,000 patients, found that long-term benzodiazepine use was associated with an 84% increased risk of Alzheimer's disease. 84%. Here's what's happening. These drugs work by flooding your brain with GABA, the chemical that quiets everything down. Anxiety fades, tension dissolves, but over months and years, your brain adapts. It needs more and more to feel the same effect, and the circuits responsible for memory, alertness, and sharp thinking begin to go dark. And, same as with sleep aids, these drugs destroy your deep sleep. Every night, they prevent your brain from doing the maintenance work that keeps dementia at bay. You feel calm. Your brain is being slowly starved. Critical. Do not stop these abruptly. Benzodiazepine withdrawal can be dangerous. Talk to your physician about a supervised tapering plan. But have that conversation now. This one stops people cold, because PP is don't block acetylcholine. They seem completely unrelated to memory. That's exactly what makes them so dangerous. Here's the mechanism nobody tells you about. Your stomach acid is how your body absorbs vitamin B12. B12 is absolutely essential to brain function. It builds the protective coating around your nerve fibers. Without it, nerve signals slow, memory fades, mood collapses. PP is suppressed stomach acid. Long-term PPIUs destroys your ability to absorb B12. And you'd never know because B12 deficiency doesn't announce itself. It whispers, quietly, for years. A study in JAMA Neurology, stole 73,000 adults, found that taking PP is for more than 2 years increased dementia risk by 44%. 44%. For a pill marketed as completely safe for long-term use. Here's the thing. If you catch this early, it's often reversible. B12 supplementation, dietary changes, or addressing the root cause of your acid reflux can restore what was being lost. But you have to know to look. Get your B12 checked. Today, not next year. Ask your doctor at your very next appointment, now. Before number 1, I need you to hear this. If you've recognized yourself in any of the medications we've covered so far, what I'm about to tell you is the most important thing in this entire video. Because number 1 isn't what you're expecting. Most people have never connected this drug to memory loss. Not even close. Here it is, the one that changes everything. Quetiapine, Seroquel, is an antipsychotic medication. It was developed for schizophrenia and bipolar disorder, and right now, millions of older adults are taking it every night for sleep. Off-label, low dose, presented as a gentle option, without being told what it actually is. Here's what quetiapine does to your brain. At the same time it's putting you to sleep. It blocks dopamine receptors, histamine receptors, and acetylcholine receptors. All 3, simultaneously. Your brain's memory system, reward system, and arousal system suppressed together, every single night. A 2018 study in the British Journal of Psychiatry found that antipsychotic use in older adults, even at low doses, doubled the risk of dementia within 2 years. Doubled. And a 2021 meta-analysis in JAMA Psychiatry, over 700,000 patients, found measurable cognitive decline after just 3 months of antipsychotic exposure. 3 months. Are you sleeping better? Probably. Is your brain paying a catastrophic price for that sleep? The research says yes. And here's what makes me most passionate about this particular drug. Many of the patients taking it don't even know it's an antipsychotic. They were told it helps with sleep. They were not told about the dementia risk. They were not told about the alternatives. That is not acceptable. Step 1. Request an anticholinergic burden review. Walk into your doctor's office and say these exact words. I want to know my total anticholinergic cognitive burden score based on everything I'm taking. This is a real validated clinical tool. Any physician can calculate it. If they're not familiar, ask for a referral to a geriatrician or clinical pharmacist. This one conversation could change everything. Step 2. Get your labs done. Ask for B12, magnesium, and iron levels. If you've been on a PPI for more than a year, these may already be critically low. Deficiencies that show up in your blood show up in your brain long before they show up in your blood work. Don't wait. Step 3. Identify the root cause, not just the symptom. Can't sleep? Let's find out why. Is it sleep apnea, nighttime urination, anxiety, chronic pain? And treat the actual cause instead of chemically suppressing your brain's most critical functions. Don't stop medications abruptly. Do this with your physician. But start the conversation today. I want to be completely honest with you. 6.9 million Americans over 65 are living with Alzheimer's right now. The CDC says that number is going to more than double by 2060. But buried inside those statistics is something that doesn't get reported. A significant number of those cases were accelerated, or even triggered, by medication. Not by destiny, not by genetics, by pills that were supposed to help. And once cognitive decline reaches a certain point, once the damage becomes structural, it doesn't reverse. I'm not telling you this to scare you. I'm telling you this because you are still on this side of that line. You have time to act. You have time to have these conversations, adjust these medications, restore what's being depleted. But that window is not open forever. The average Medicare patient over 65 is taking 4.5 prescription medications right now. Many of you are taking more than that. Each one might seem safe individually, but the combination, the total burden, can push your brain past the threshold. Nobody is looking at your whole list with this specific question in mind, unless you ask them to. Tonight, when you stand up from this chair, I want you to think about one thing, not about fear, not about what might happen, about your life, the one you are still living, the grandchildren you want to remember by name in 10 years, the conversations you want to have, the independence you've worked your whole life to protect. Your brain is not finished. It is not set in stone. It has more capacity for recovery than most people are told, but it needs you to act. Ask the questions, get the labs, request the review. Have the conversation you didn't know you needed to have. That's not weakness. That's exactly what strength looks like at this stage of your life. You watch this entire video. That tells me something about you. You're not someone who accepts decline without a fight. Good. Don't stop now. If this video gave you something real, please share it with someone you love over 60. They deserve to know this too. And if you want more medically grounded content created specifically to protect your independence, subscribe. Every video I make is built around one goal: keeping you sharp, strong, and in control of your own life. I'm Dr. Adrian Solberg. Stay aware, stay proactive, and take care of your body. I'll see you in the next video.